Have you ever noticed how a single health headline can stay with you longer than it should? Especially late at night when sleep feels lighter and worries feel louder. One of my patients once shared that what frightened her most was not the illness itself, but the feeling that she did not know which symptoms truly mattered and which ones did not. Now I want you to imagine this. You are sitting comfortably, listening to a calm conversation that helps you understand your body instead of making you second-guess it. I am Dr. Evelyn Carter, and for many years I have cared for older adults who want clarity, not alarm. I know how unsettling health news can feel as we age. Memory may feel more fragile. Sleep may come and go. Anxiety can arrive faster than it once did. From real clinical experience, I can tell you that symptoms often feel more frightening simply because they are unfamiliar or poorly explained. The Nipah virus is rare and not commonly encountered in daily life here in the United States. Most seniors are not facing immediate danger. Still, the word symptoms can easily create fear. Many people imagine the worst before understanding what doctors actually watch for. In medicine, patterns matter more than isolated sensations. Knowing that difference can bring the body a sense of calm. The purpose of this video is gentle and clear. It is not about alarm. It is about learning which Nipah virus symptoms truly deserve attention and which do not require panic. Awareness is meant to support confidence, not create fear. When you understand what is meaningful, your mind can rest and your routines can stay steady. For today, understanding alone is enough. You do not need to monitor your body obsessively or change how you live. Think of this as a quiet conversation with a physician who respects your pace, your dignity, and your life experience. If you find this kind of calm explanation helpful, please take a moment to subscribe, like, and share Senior Health Daily. Your support allows us to continue creating trusted health guidance for older adults across the country. In the next part, we will move slowly through medical insight, caregiving experience, and practical guidance designed specifically for seniors and those who care for them, always keeping clarity and reassurance at the center of our time together. Why symptoms matter more than headlines. As we continue together, I want to begin by gently shifting where we place our attention. In medicine, we learn very early that headlines do not heal people. Symptoms do. Patterns do. Context does. This distinction becomes even more important as we age. Health headlines are designed to move quickly. They are written to catch attention, not to care for the nervous system. I have met many older adults who came into my office worried because of something they read or heard, only to discover that their bodies were simply responding to normal changes, fatigue, or stress. The fear did not come from their symptoms. It came from the story wrapped around those symptoms. Doctors focus on patterns, not isolated moments. One mild headache, one restless night, or one day of low energy rarely tells us much on its own. What matters is how symptoms behave over time. Do they repeat? Do they progress? Do they interfere with daily life? This is how physicians think, even though headlines rarely explain it this way. Seniors are especially vulnerable to misinterpreting mild changes because aging brings more bodily signals. Muscles may feel stiffer in the morning. Sleep may be lighter. Appetite may shift slightly. These changes are common and usually harmless, but when paired with alarming news, they can feel threatening. I have seen patients become anxious about normal sensations simply because they were told to watch for danger everywhere. Clarity protects emotional health. When older adults understand which symptoms deserve attention and which ones can be observed calmly, their bodies respond differently. Breathing slows, shoulders drop, sleep improves. This is not psychological weakness. It is biology. The immune system works best when the mind feels safe. From years of clinical experience, I can tell you that unnecessary worry often causes more harm than the symptom itself. Stress hormones rise, blood pressure increases, memory feels less reliable. Balance can even be affected. When clarity replaces fear, these effects often soften without any medication. This is why we are talking about symptoms, not headlines. Symptoms are personal. They belong to your body, your routine, your life. Headlines are distant. They cannot see you. They cannot know your history. Doctors listen to symptoms because they carry meaning when placed in the right context. As we move forward, my goal is to help you understand how physicians interpret symptoms calmly and carefully. Not to make you watch your body with suspicion, but to help you trust it again. When seniors learn to read their bodies with confidence rather than fear, emotional health strengthens. And emotional health is one of the most powerful protectors of physical well-being as we age. What Nipah virus symptoms actually look like. When people hear about symptoms linked to a serious virus, the imagination often fills in frightening details. In real medical practice, symptoms usually begin quietly and look much more ordinary than people expect. This is why careful explanation matters, especially for older adults who may already feel more sensitive to changes in their bodies. Early Nipah virus symptoms often resemble those of many common illnesses. A person may notice a low-grade fever, a general feeling of fatigue, or muscle aches that feel similar to having the flu. Some people experience headaches or mild discomfort that comes and goes. These sensations on their own do not immediately signal something dangerous. Doctors see these kinds of symptoms every day, and most of the time they are linked to routine infections or temporary stress on the body. What physicians look for is not just the presence of a symptom, but how it behaves. We pay attention to timing, progression, and combination. Does the fever persist or climb higher over time? Does fatigue worsen instead of improving with rest? Are headaches becoming more intense or paired with confusion? These patterns help doctors distinguish between general discomfort and something that requires closer attention. Serious warning signs are different because they interfere with daily function. Difficulty staying awake, confusion that feels unusual for the person, trouble speaking clearly, or weakness that affects movement are symptoms doctors take seriously. These are not subtle sensations. They change how a person moves through their day. When symptoms affect thinking, balance, or awareness, they stand out clearly from ordinary aches or fatigue. From my clinical experience, many seniors worry because they feel tired or achy and assume it must mean something severe. Aging bodies communicate more often, but that does not mean they are in danger. Doctors understand this difference. We expect some variability in energy, sleep, and comfort as people age. These changes are part of living, not signs of illness. It is also important to remember that context matters. Nipah virus is rare, and symptoms must be interpreted within that reality. Physicians do not look at one symptom in isolation. We consider medical history, recent exposures, and overall health. This broader view prevents unnecessary alarm and protects emotional well-being. Understanding what symptoms actually look like helps the mind stay grounded. When older adults know that early symptoms are often nonspecific and that serious warning signs are distinct and noticeable, fear loses its grip. Confidence grows. The body responds to that confidence with steadier breathing, better sleep, and clearer thinking. That calm awareness allows seniors to notice meaningful changes without feeling overwhelmed by every sensation their bodies send. Early Nipah virus symptoms versus ordinary illness. One of the most helpful things we can do together is place early symptoms into proper context. Without that context, the mind often jumps to the worst possible explanation. With context, the same symptoms feel far less frightening and much easier to understand. Early Nipah virus symptoms can look very similar to what many of us experience during an ordinary illness: a mild fever, feeling unusually tired, a headache that comes and goes, or general body aches are all sensations doctors see every day. These are also the same symptoms that appear with common colds, seasonal viruses, dehydration, or even poor sleep. For older adults, fatigue alone can follow a busy day, emotional stress, or a night of restless sleep. What often causes distress is not the symptom itself, but the meaning we assign to it. I have cared for many seniors who felt a wave of fear simply because they noticed they were more tired than usual. When we slowed down and looked at their routines, the explanation was often clear. Changes in weather, disrupted sleep, missed meals, or mild infections explained what they were feeling. The body was asking for rest, not signaling danger. Doctors are trained to look for differences in behavior, not just the presence of a symptom. With ordinary illnesses, symptoms tend to improve with time, rest, and hydration. Energy slowly returns, appetite normalizes, sleep becomes deeper again. With something more serious, symptoms usually intensify rather than fade. They begin to interfere with daily life in noticeable ways. Another important difference is clarity of thinking. Common colds and fatigue may leave someone feeling sluggish, but they do not usually cause confusion, disorientation, or difficulty communicating. When thinking feels clearly altered in a way that is new or concerning, doctors pay closer attention. These changes stand apart from the normal ups and downs of aging. It is also essential to remember how rare Nipah virus is, especially in the United States. When a condition is uncommon, it should not be the first explanation we reach for when familiar symptoms appear. Physicians always consider the most likely causes first. This approach protects both physical and emotional health. From my experience, seniors feel much better when they understand that not every symptom requires immediate concern. Awareness does not mean constant monitoring. It means noticing patterns calmly. Is the symptom passing or progressing? Is it affecting daily activities or remaining mild? These questions guide wise decisions without panic. Understanding the difference between early symptoms of a rare illness and ordinary discomfort allows older adults to trust their bodies again. It keeps routines steady and minds at ease. When fear is replaced with perspective, the body responds with calmer breathing, better sleep, and renewed confidence. That confidence is one of the most valuable supports for healthy aging. How aging changes symptom awareness as we age. The body continues to communicate, but it often does so in quieter and more nuanced ways. This is something I have observed throughout my years caring for older adults. Aging does not make symptoms more dangerous by default. It simply changes how they appear and how we notice them. Younger bodies often respond to illness with clear and dramatic signals, such as high fever or sudden exhaustion. Aging bodies may respond more subtly. A senior might feel slightly off balance, less interested in food, or more tired than usual rather than sharply ill. These softer signals can feel unsettling because they are harder to interpret, but subtle does not mean severe. Many seniors tell me they notice changes more quickly now than they did years ago. That awareness is not a weakness. It is a sign of experience. Older adults have lived long enough to recognize when something feels different. This sensitivity helps people respond earlier and more thoughtfully to their needs. It does not mean the body is fragile or failing. From a clinical standpoint, there are clear reasons for these changes. Metabolism slows, sleep patterns shift, muscles recover more gradually. The immune response may take longer to ramp up, which can result in milder early symptoms rather than intense ones. Doctors understand this and take age into account when evaluating how symptoms present. What matters most is how symptoms affect daily life. Feeling a bit more tired one afternoon is very different from being unable to complete familiar tasks. A reduced appetite for a day is not the same as ongoing difficulty eating. Doctors look for patterns over time, not isolated moments. This approach protects seniors from unnecessary worry and overtreatment. I have seen many older patients become anxious simply because they felt something new and assumed it must be dangerous. Often, the explanation was gentle: a change in routine, a night of poor sleep, dehydration, emotional stress. When we addressed these factors, the symptoms eased without further concern. It is also important to remember that aging bodies recover differently. Healing may take a little longer, but it still happens. Patience becomes an important part of care. Rushing to conclusions can create stress that interferes with recovery. Understanding how aging changes symptom awareness allows seniors to meet their bodies with respect rather than fear. Subtle signals are invitations to pause, rest, and observe, not reasons to panic. When older adults trust that their bodies are communicating honestly and calmly, they feel more grounded. That grounding supports emotional safety, clear thinking, and confidence in daily life. Awareness is meant to support wisdom, not alarm. By recognizing that aging bodies speak more softly, seniors can listen with patience and respond with care, preserving both health and peace of mind. When symptoms truly need medical attention. Knowing when to seek medical care is one of the most important skills seniors can have, and it does not need to be driven by urgency or fear. In my years of practice, I have found that calm decision-making protects health far better than rushing to conclusions. Most symptoms that come and go, especially mild fever, temporary fatigue, or body aches that improve with rest, do not require immediate medical attention. Aging bodies often ask for a slower pace. A good night of sleep, hydration, and a return to familiar routines are often enough. Doctors expect this kind of variation, and it is usually harmless. Medical attention becomes important when symptoms change how a person functions day to day. If someone becomes unusually confused, has difficulty staying awake, struggles to speak clearly, or notices weakness that affects walking or balance, those are signs to take seriously. These changes stand out because they interrupt familiar patterns. They are not subtle. They are noticeable shifts from a person's usual baseline. Persistence also matters. Symptoms that continue to worsen instead of easing deserve evaluation. A fever that remains high over time, increasing confusion, or a steady decline in energy that does not improve with rest are signals to reach out to a healthcare provider. This is not about assuming the worst. It is about noticing progression rather than isolated moments. Context is always part of the decision. Doctors consider recent travel, known exposures, overall health, and existing medical conditions. Because Nipah virus is rare in the United States, physicians do not assume it is the cause when common symptoms appear. They look first at the most likely explanations. This careful approach protects seniors from unnecessary tests and anxiety. For caregivers, especially those supporting someone with memory changes, calm observation is key. You know your loved one's patterns better than anyone. If something feels clearly different and is not resolving, that insight is valuable. At the same time, it helps to remember that occasional changes in mood, appetite, or energy are common with aging and do not always signal illness. I often tell my patients that seeking medical advice does not mean something is wrong. It means you are taking care of yourself thoughtfully. Calling a doctor, describing symptoms calmly, and asking questions is part of good health management. It does not require panic or urgency. The goal is not to watch the body with suspicion. It is to stay connected to it with respect. When seniors understand which changes truly deserve attention, they feel more confident and less anxious. That confidence supports clearer thinking, better sleep, and steadier routines. Calm decision-making allows medical care to do its job properly. It keeps health choices grounded and compassionate, and it reminds older adults that they are capable of responding wisely to their bodies without fear guiding every step. Staying informed without becoming anxious. One of the quiet challenges many seniors face today is not a lack of information, but too much of it arriving all at once. Health news moves quickly, often without context, and it can leave the mind feeling unsettled. I have spoken with many older adults who told me they felt more anxious after watching or reading health updates, even when nothing had changed in their own bodies. Information overload affects emotional health in very real ways. When the brain is constantly exposed to urgent messages, it remains in a state of alert. This can interfere with sleep, make concentration harder, and heighten normal bodily sensations. A mild ache or a day of low energy can suddenly feel alarming simply because the mind has been primed to expect danger. From a medical perspective, this kind of stress does not help the body. Elevated stress hormones can weaken immune responses, increase blood pressure, and make memory feel less reliable. In older adults, Emotional strain often shows up physically, even when there is no underlying illness. This is why how we receive information matters just as much as what the information says. Staying informed should feel supportive, not overwhelming. It means choosing sources that explain rather than alarm and allowing information to come at a pace the mind can absorb. When learning feels calm, understanding settles naturally. The body relaxes, and symptoms are easier to interpret without fear. This is exactly why spaces like Senior Health Daily exist. The goal is not to react to every headline, but to place health topics into perspective. When information is shared with patience and respect, it becomes a source of reassurance rather than stress. Many seniors tell me they find comfort in returning to familiar voices and steady explanations. That consistency supports emotional balance. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. I want to emphasize that you do not need to follow every update or monitor every sensation to take good care of yourself. Awareness is not the same as vigilance. It is about understanding what matters and letting go of what does not. When seniors feel emotionally safe, their bodies respond with steadier breathing, better sleep, and clearer thinking. Information, when offered calmly, can support that safety. By choosing thoughtful sources and giving yourself permission to step back from constant updates, you protect not only your peace of mind, but your overall health as well. Staying informed should help you live your life with confidence, not keep you on edge. When knowledge is paired with calm, it becomes one of the strongest supports for healthy aging. Daily routines that support symptom awareness. One of the most reliable ways older adults stay connected to their health without becoming worried is through regular daily routines. Over many years of caring for seniors, I have seen how routine creates a quiet baseline. When life follows a familiar rhythm, the body's signals become easier to understand. Routines help because they give the mind something steady to return to. Waking up at a similar time, eating meals on a predictable schedule, taking regular walks, and resting at familiar hours allow the body to settle into a pattern. When that pattern is in place, meaningful changes stand out naturally. You do not have to watch your body closely or search for problems. Differences simply become noticeable on their own. For example, when someone eats breakfast every morning, it is easy to notice if appetite suddenly changes. When a person walks the same route most days, it becomes clear if balance feels different. When sleep follows a familiar rhythm, disrupted rest is easier to recognize. These observations happen gently, without fear, because they are grounded in familiarity rather than vigilance. This approach is especially helpful for seniors because it protects emotional health. Constant self-monitoring can create anxiety, which makes ordinary sensations feel threatening. Routine does the opposite. It reassures the nervous system that life is stable. When the mind feels safe, it can observe without panic. From a clinical perspective, doctors rely on this kind of awareness. When patients can describe how something feels different compared to their usual routine, it gives valuable information. Saying, "I normally feel steady during my walk, but today I felt unsure," tells us much more than listing symptoms in isolation. Routine provides context, and context guides wise decisions. I have also seen how routine supports dignity and independence. Seniors who maintain daily rhythms feel more confident in managing their health. They trust their ability to notice changes without assuming danger. This confidence reduces unnecessary medical visits and allows care to be sought calmly when it is truly needed. For those caring for someone with memory changes, routines are even more important. Familiar patterns reduce confusion and agitation. When routines remain consistent, caregivers can more easily recognize when something is truly different rather than part of normal fluctuation. This shared awareness protects both the caregiver and the person receiving care. It is important to remember that routine does not mean rigidity. Life can still be flexible and enjoyable. Routine simply provides a steady framework. Within that framework, the body communicates clearly. When seniors live within familiar rhythms, symptom awareness becomes natural and calm. There is no need for constant checking or worry. Changes are noticed because they stand out against a stable background. That stability supports emotional safety, clear thinking, and confident decision-making. Daily routines are not small habits. They are powerful tools that allow seniors to stay connected to their health while preserving peace of mind. Dementia, memory changes, and symptom communication. Caring for someone with memory loss requires a different kind of attention, one that protects emotional safety while still honoring physical health. Over the years, I have learned that recognizing symptoms in a loved one with dementia is less about searching for signs and more about noticing changes within familiar patterns. People living with memory changes may not be able to describe what they feel clearly. They might not say they have pain or feel unwell. Instead, symptoms often show up through behavior. A person who usually enjoys meals may begin to push food away. Someone who is normally calm may seem restless or withdrawn. Sleep patterns may shift, or walking may feel less steady. These changes are meaningful because they represent a departure from what is familiar. What matters most is how we respond. Fearful reactions can increase confusion. When caregivers become anxious or rush to explain what might be wrong, the person with memory loss often senses that tension before they understand the words. The nervous system responds to emotion first. This is why calm observation is such a powerful tool. In my caregiving experience, reassurance protects dignity. Speaking slowly, using a gentle tone, and keeping explanations simple helps the person feel safe. Instead of asking many questions at once, it is often better to observe quietly and make note of changes over time. Patterns tell a clearer story than isolated moments. Protecting emotional safety also means shielding loved ones from unnecessary information. They do not need to carry the weight of medical concerns or hear alarming possibilities. That responsibility belongs to caregivers and health professionals. For the person living with dementia, feeling secure in the present moment is far more important than understanding every detail. Routine plays a central role here. When daily rhythms remain consistent, it becomes easier to notice meaningful changes. A missed meal, a new reluctance to walk, or increased confusion during a familiar activity stands out clearly against a stable background. This clarity allows caregivers to share accurate information with healthcare providers without causing distress. I have often reminded families that noticing a change does not require immediate urgency. It requires thoughtful attention, calmly contacting a doctor, describing what feels different compared to the person's usual behavior, and asking for guidance is a respectful way to care. This approach preserves trust and reduces fear for everyone involved. Caring for someone with memory loss is not about constant monitoring. It is about presence. When caregivers remain patient and grounded, they create an environment where symptoms can be recognized without alarm. That environment supports comfort, cooperation, and dignity. By focusing on familiar patterns, gentle observation, and emotional safety, caregivers can recognize when something truly needs attention while protecting the well-being of those they love. This balance allows care to feel humane and steady, even as memory changes progress. The role of community and medical systems. One of the most important messages I want older adults to hear is this: you are not responsible for monitoring everything on your own. Health was never meant to be carried alone, especially as we age. Strong systems exist quietly in the background to support you, watch patterns, and step in when needed. Over the years, I have met many seniors who felt they had to stay constantly alert, as if missing one detail could put them at risk. That kind of pressure is exhausting and unnecessary. Medicine does not work that way. Healthcare is built on shared responsibility. Doctors, nurses, clinics, public health teams, and caregivers all work together. So individuals do not have to carry the full burden of awareness. Medical systems are designed to notice what individuals cannot. Patterns across communities, unusual clusters of illness, and changes over time are monitored continuously. This allows concerns to be addressed early and thoughtfully. Seniors do not need to track global health information or interpret every headline. Those tasks belong to professionals trained to do so. Community support also plays a powerful role. Family members, neighbors, caregivers, and trusted sources of information create a safety net that supports both physical and emotional health. Feeling supported reduces stress, and science has clearly shown that lower stress supports better immune function, clearer thinking, and steadier moods in older adults. I have seen how reassurance changes outcomes. Seniors who trust their care systems tend to sleep better, eat more regularly, and remain engaged in daily life. They feel permission to live fully rather than remain on constant watch. That sense of trust allows the body to conserve energy for healing and resilience. For those living with memory changes, this shared care is especially important. When systems and caregivers work together, individuals can remain focused on the present moment, rather than feeling unsettled by uncertainty. Familiar routines and consistent care help protect emotional safety, even when understanding fades. Trusting medical systems does not mean giving up independence, it strengthens it. When seniors know help is available, they feel more confident making everyday choices. They are more likely to ask questions, seek guidance calmly, and stay connected to their communities. Health is not a solo responsibility, it is collective. You are supported by layers of care designed to protect you without demanding constant vigilance. When seniors allow themselves to trust these systems, they create space for calm, dignity, and confidence to remain at the center of daily life. Trusting the body while staying engaged in life. As we reach this final section, I want to return to a message that sits at the heart of healthy aging. Awareness is meant to expand confidence, not restrict daily life or independence. Learning about symptoms should help you trust your body more, not live in fear of it. Over the years, I have watched many older adults grow quieter and more cautious than they needed to be. They stopped walking as far, visiting friends as often, or trying new activities, not because their bodies could not handle it, but because worry slowly narrowed their world. That kind of shrinking happens quietly, and it often does more harm than any illness ever could. Your body carries wisdom. It has adapted through decades of change, recovery, and resilience. Even now, it continues to communicate honestly. When you learn to listen calmly rather than react quickly, confidence grows. You begin to recognize the difference between ordinary signals that pass and meaningful changes that deserve attention. That understanding allows you to stay engaged with life instead of pulling away from it. Medical care exists to support this trust, not replace it. Doctors and healthcare systems are partners, helping guide decisions when something truly changes. Most of the time, your role is simply to live well, to move your body in ways that feel good, to stay connected to people and routines that bring meaning, to rest when needed and enjoy the days that feel lighter. Science supports this approach. Regular movement supports balance and strength. Social connection supports memory and emotional health. Staying mentally engaged helps protect cognitive function. These benefits do not come from avoidance. They come from participation. Awareness should give you permission to live fully, not cautiously. It should remind you that noticing your body does not require constant concern. It requires respect and patience. When you trust your ability to recognize change calmly, you preserve independence and dignity. I want you to feel encouraged to keep engaging with life. Walk when you can. Laugh often. Stay curious. Let understanding support your confidence rather than limit it. Healthy aging is not about guarding against every possibility. It is about trusting the body you have lived in for so long and allowing it to carry you forward with steadiness, connection, and purpose. As we come to the end of our time together, I want to slow everything down and thank you for staying and listening. Choosing to understand your health with patience is already an act of care. You did not need to fix anything today. Understanding alone is enough for this moment. What we explored together about Nipah virus symptoms is not a story of fear. It is a story of balance. Balance between awareness and calm. Balance between science and daily life. balance between paying attention and trusting the body you have lived in for so many years. When learning is placed in that balance, it supports confidence instead of worry. I want to reassure you that you do not need to change how you live or stay on constant alert. Aging bodies respond best to steadiness. Familiar routines, regular meals, gentle movement, and emotional safety do more for health than constant monitoring ever could. When life feels predictable and calm, the body works with you, not against you. For those of you caring for a loved one with memory changes, I want to speak to you directly. Your calm presence matters. Your patience matters. Reassurance offered again and again is a powerful form of protection. Even when words are forgotten, the feeling of safety remains. That feeling supports comfort, trust, and dignity in ways medicine alone cannot. Health is not about controlling every unknown. It is about trusting careful science, trusting supportive systems, and trusting your own wisdom. You are not behind. You are not missing anything. You are doing enough by approaching your health with openness and care. Senior Health Daily is here as a quiet, reliable place you can return to whenever health information feels overwhelming. You are not alone on this path, and there is never a need to rush your understanding. I invite you to stay connected with us so we can continue moving forward together with patience, dignity, and calm.